Cattle producers everywhere have to constantly guard against bovine respiratory disease, the leading cause of economic losses in the beef industry. The lungs of cattle are very prone to infection. Within hours, bovine respiratory disease, BRD for short, can cause irreversible damage to the lung tissue. If untreated, BRD can result in a quick death of the affected animal, or in stunted growth and reduced meat quality. BRD is triggered by infectious and environmental factors. Examples are a respiratory viral infection or stressful external conditions affecting the animal's immune system. Naturally occurring bacteria in the nasopharynx normally pose no problem, but the weakening of the immune system allows them to multiply excessively, and the infection can spread into the lung. Here, tissue-resident macrophages recognize and phagocytize the bacteria. As cells are destroyed, cytokines and other inflammation mediators are released, thereby furthering the inflammatory reaction. One of the enzymes activated in the surrounding tissue and immune system cells is cyclooxygenase, COX, resulting in the production of prostaglandins. The prostaglandins play a crucial role in the inflammation now developing at full speed in the tissue. Prostaglandins dilate local blood vessels, slow down the pace of the bloodstream, and increase the permeability of the vessel walls. In this way, fluid and cells of the immune system, such as neutrophils and monocytes, are drawn in large quantities to the site of the inflammation. At the same time, the presence of cytokines, such as IL-1 in the bloodstream, stimulates the production of prostaglandins in the brain. The hypothalamus reacts by upregulating body temperature. The immune cells, drawn to the inflammation site, now start producing even more cytokines and prostaglandins, thus intensifying the inflammation. The result is a self-propelling vicious cycle. Unchecked, the bacterial toxins are able to inflict severe damage on the tissue cells. The accumulating immune cells, such as neutrophils, release oxygen radicals in order to destroy the bacteria. But these radicals also worsen the tissue damage. But why is BRD such a common and important disease in cattle? Why exactly is the bovine lung so particularly vulnerable to bacterial infection? The reasons are both anatomical and physiological. Compared to the horse, the capacity of a cow's lung is much smaller. It is 1/3 that of a similar-sized horse. Its oxygen needs at rest are 2.5 times higher. To satisfy basal oxygen demand, the bovine lung is used much more intensively. Other peculiarities of the bovine lung, such as a high degree of segmentation, a lack of collateral ventilation, and a large amount of connective tissue, are reducing the lung's ability to cope with invading pathogens and the resulting inflammation. Once the lung is infected, inflammation and bacterial toxins cause lesions to develop, leading to severe and often irreversible damage to functional lung tissue. The result is the appearance of the telltale symptoms of BRD, such as breathlessness, fever, loss of appetite, and depression. The economic impact of bovine respiratory disease is enormous. The performance of the affected animals is severely reduced, as measured by carcass weight and quality at slaughter. Moreover, death can result if BRD is not diagnosed in time or remains untreated. Because of the rapid progression of the disease, treatment with antibiotics alone is insufficient. The situation calls for a drug able to cope with the speed of development of BRD. The rapidly spreading inflammation has to be kept in check as the antibiotic goes to work against the bacteria. Resflor Gold, a 2-in-1 combination of an antibiotic and an anti-inflammatory, achieves just that, simultaneous control of both bacterial infection and local inflammation. Resflor Gold contains 2 complementary active substances, florfenicol and flunixin. Flunixin belongs to the well-known class of non-steroidal anti-inflammatory drugs, just like aspirin, and exerts its effect by blocking COX, the enzyme producing prostaglandins. One effect of blocking COX is the reduction of the animal's fever by the central nervous system. As a result, the animal will feel better and start eating and drinking again, usually within 4 to 6 hours of treatment. At the site of inflammation, flunixin also inhibits COX enzyme activity. As a result, the formation and release of prostaglandins is reduced and the inflammation abates. Fewer additional immune cells are drawn to the inflamed tissue, and the vicious cycle of an ever-intensifying destructive inflammation is broken. While the vicious cycle of inflammation is being controlled by flunixin, the antibiotic component of Restflor Gold, florfenicol, very rapidly goes to work fighting the bacteria. Florfenicol is a broad-spectrum, bactericidal and bacteriostatic antibiotic. Its lipophilic properties allow florfenicol to spread very rapidly throughout the animal's tissue, and also to permeate the bacterial cell walls. Ribosomes in the bacterial cell are responsible for the synthesis of proteins essential for proliferation and survival of the bacterium. At the bacterial ribosome, transport RNA is supplying the individual amino acids, which the messenger RNA strings together, the so-called translation, into protein. Florfenicol binds to the bacterial ribosome and thus disables the formation of a peptide chain. Consequently, the synthesis of bacterial proteins is inhibited. In this way, the rapid multiplying of the bacteria is stopped. Immune cells will deal with any that remain. To sum up, Restflor Gold treats both the infection and the inflammation. It is applied in a single 2-in-1 subcutaneous injection, minimizing handling and stress for the animals. The benefits of combining two active substances in Restflor Gold and of the resulting dual action are evident. The development of extensive irreversible lesions in lung tissue is avoided. Bovine respiratory disease is managed effectively with Restflor Gold, as are the economic consequences associated with BRD. Restflor Gold. Every breath counts.